My name is Ann Johnson. Proudly represent Texas House District 134, which covers the medical center. And I'm grateful to have an opportunity to visit with the Texas Orthopaedic Surgeons Association here in Houston for the annual conference. You know, I think for those that already know or are really into it, they get that there are 150 Texas House members. We are a part-time legislature, which means all of us have our own jobs and responsibilities, but our obligation is really to represent the interests of the district. And so I'm grateful that I have a chance to represent the Texas Medical Center. I've been a patient numerous times of orthopedic surgeons, and I'm a cancer survivor. And so I've had the ultimate experience as a consumer of world-renowned healthcare. And so as somebody that feels this driving force to protect not only the integrity of the Texas Medical Center, which I do believe is the world's best medical community, but as a Texan, I also know that this is one of the most significant economic driving factors of our state. And so I do feel an urgency to protect the integrity of the institution and, if you will, the ability to let physicians be physicians, let hospitals do what they need to do, and really try to guard against political interference. And so a lot of folks don't realize that, Washington, D.C. gets headlines and Congress gets headlines, but really it's those of us that go to Austin every other year that most significantly impact your medical practice. Everything the association has to encounter comes up in 140 days every other year in regular session. It's important to recognize we are part-time members. It feels often like a full-time job, and we feel that, but in reality there's this mad dash and mad rush in which the association and the membership needs to be able to come to us as members and say, these are the things that we need, and or these are the things that you're trying to pass that's actually going to have a detrimental impact on us. But also building relationships in that off time. Being able to come to somebody like me, recognize my role, my personal profession, the way that I've been a consumer, and be able to explain the interest of the community and how the legislation that we're passing actually affects everybody.